Hi, my name is Aimee Slagle, and I was a graduate student in the Public Health and Latin American Studies program. I participated as the Global Health Institute Scholars in the summer of 2023 in Egypt. I worked on validating the Harmonized Cognitive Assessment Protocol. My site was the American University in Cairo. I worked under the guidance of Dr. Mohammed Salema on a project trying to expand an assessment of cognitive decline called HCAP, or Harmonized Cognitive Assessment Protocol. This protocol is a hodgepodge of various assessments trying to evaluate different cognitive domains, and with the end goal of being able to expand HCAP to include various cultural and geographical contexts, so having it applicable to different nations. And I worked on trying to understand what is HCAP and what is some of the validation processes happening, and how can we apply that to the Egyptian population. So I did an extensive literature review looking at the validation process for other different geographical settings. I elaborated a pre-existing cross-national comparison chart that essentially looked at all of the assessments included in the original HCAP and how different nations and different organizations are adapting it to be relevant to different cultural, geographical, and literacy contexts. The one that I paid exceptional attention to was the one in Lebanon, which is the one most comparable to Egypt, given the language and the cultural and the geographical region. And what HCAP is allowing is that these partners, other international institutions, adapt the HCAP to be more relevant and to be more useful, given the different level of resources or the different populations that they're working with. Some key takeaways: I understood through this project the importance of expanding global health research to be more inclusive of diverse populations. The end goal of HCAP is to really understand what are some modifiable risk factors of cognitive neurodegeneration. So understanding how we can use evidence to create effective potential preventative or treatment programs based on what's happening in specific populations. I also learned about how time and resource intensive a study like this can be. Again, we were just really working on the validation process, the piloting process of HCAP for the Egyptian population. However, it takes quite a bit of time of translating, of adapting, of running statistical analysis, and really takes a big team of diverse skills to run a study like this. And there's some difficulties still with cross-national comparisons, although the HCAP network is really trying to assist in eliminating some of these errors in comparison between different contexts. However, because there's ability to adjust these assessments for the different contexts, it does allow potential variability based on the assessment itself, rather than potential differences between nations or population. I'd like to give a special thanks to my main collaborators, Sarah Mustafa, who is a graduate student on the PhD track at the American University in Cairo, and to the right is Dr. Mohammed Salema, who was my main supervisor during the project. Thank you.